distinguish from intolerances in animals. The reason for this is that in animals, food hypersensitivities are thought to be type 1, 3, or 4 hypersensitivity reactions. They're not strictly type 1 or IgE mediated reactions. They can be, they're different immunological reactions, not just the IgE. And this is one of the reasons why the serum allergy testing for food allergies is just not accurate in our pets, is because those serum allergy tests are just looking at IgE, and we know that in animals the food hypersensitivities aren't just IgE mediated. And we mentioned a little bit, about intolerances. So non-toxic, non-immunological based reactions are known as intolerances, and that these cutaneous adverse food reaction term is kind of our umbrella term for true hypersensitivity reactions, but also skin reactions that may be developing from food intolerances, just because they're so hard to distinguish in animals. So actual food allergy, this is IgE mediated in people. We've seen most commonly in children. And infants with food allergy have been evaluated to determine possible markers for the development of atopic dermatitis later in life, because that is seen in people. And about a third of children with atopic dermatitis do have a concurrent food allergy. As I mentioned before, it does not seem to be just IgE mediated in the majority of dogs. And a specific mechanism has not been identified, but it's thought to be multiple different hypersensitivity type reactions. So this is what I tell my clients and referring veterinarians, is that cutaneous adverse food reactions really are not as simple as we have been made to believe they are. It's really not clear cut yet, and different studies have shown different things. So these are some important ones. So 13 to 30% of dogs diagnosed with cutaneous adverse food reactions have also been reported to exhibit concurrent atopic dermatitis, and there are multiple papers that report this wide range. Interesting other things that have been reported in studies is that there are food items that have been associated with inducing flares in canine atopic dermatitis. So this isn't a food allergy, but this is a food-induced atopic dermatitis or food-induced flare of atopic dermatitis. Dogs with atopic dermatitis have also been shown to have higher serum anti-food IgE, even in the absence of clinical adverse food reactions. So that's an interesting thing that was shown also. So this food-induced atopic dermatitis is when food allergens can actually act as a trigger for atopic dermatitis. This isn't a reaction to the food itself, but a trigger for the dog's atopic dermatitis. And there are certain breeds that are predisposed to this, and those are listed here. Many of these dogs will have concurrent gastrointestinal disease as well, and many of them have Malassezia dermatitis. A different syndrome that I think is really cool is called oral allergy syndrome. It's really interesting how this works. So we all know that environmental allergens cause atopic dermatitis. There are certain foods, and this has been better documented in people than in dogs, but there are certain food items that actually will cross-react with a sensitized environmental allergen. And so this has been best characterized with birch pollens in people. So if people have environmental allergens and are allergic to birch pollen, if they ingest apples, carrots, celery, cherries, hazelnuts, these different fruits and vegetables, that can actually cause tingling in their mouth and their throat, and that's because of an allergic reaction to these food items, because the protein structure of these food items is similar in structure to the birch pollen that they're allergic to. So they're not actually allergic to these foods, but the protein structure is so similar that their immune system reacts to them. And so this has been characterized in people with birch pollen, grass pollen, and ragweed pollen to a variety of different foods. And the symptoms in people are perioral and oral pruritus. And some people, will say they get a scratch in their throat or they get tingling on their lips. Now, this has only been identified in dogs with tomato and Japanese cedar. So if they're allergic to Japanese cedar and they ingest tomato, dogs would get itchy after on their face. It's been identified in storage mites as well. So if dogs ingest food with storage mites in it and they're allergic to dust mite, the mites are similar, and so they have that similar reaction. As far as clinical signs go of food allergies compared with atopic dermatitis, besides food allergies being non-seasonal, there's really no way to differentiate clinically. Atopic dermatitis can look exactly the same as food allergy on our patients. And for those of you who can't see the pictures, I'm just showing pictures of the palmar surface of the metacarpal region on a dog that shows some erythema that's typically or commonly seen in atopic dermatitis and food allergy. Next slide has pictures of ears and rears that we all like to say, well, if it's ears and rears, it's food allergy. Well, it's not necessarily true. Both food allergic dogs and atopic dogs similarly can have ear infections as well as perianal pruritus. There was actually a study done that was reported a few years ago at the Derm conference that a resident did a paper to see what percentage of just atopic dogs, non-food allergic dogs, had perianal pruritus or pruritus ani, and it was about 50%. So if a dog is pruritic towards their perianal area, it does not necessarily mean that it's a food allergy versus atopic dermatitis. Similarly, interdigital erythema, we tend to associate more with atopic dermatitis, but many food allergic dogs have interdigital erythema as well. Secondary infections are very common as well. So again, allergies will cause inflammation on the skin and will also lead to usually secondary bacterial or Malassezia infections, and that can occur with both food or environmental allergies. What about cats? Again, very, very similar. Food allergies, just like environmental allergies, can induce any of the 4 cutaneous reaction patterns. Interestingly, cats have been shown to have a higher incidence of GI signs with food allergies, and those can include vomiting, diarrhea, and lymphoplasmacytic colitis. And on this slide, they're just pictures of all the different reaction patterns. So eosinophilic dermatoses, indolent ulcers on the lips, self-induced alopecia, and there's miliary dermatitis as well, which isn't shown here in a picture. But there was a really nice paper done in 2011 that showed clinical characteristics of allergic cats, both flea allergic cats, food allergic cats, environmental allergic cats. And this is what was shown with food allergic cats, is that 20% of food allergic cats exhibited miliary dermatitis, 43% exhibited symmetrical alopecia, 64% exhibited face and neck pruritus, 25% exhibited eosinophilic dermatoses, and 46% exhibited multiple patterns. This is from that same paper. And so they had these nice diagrams of these cats on where these cats are actually exhibiting clinical signs. So the picture on the top here is for non-food induced hypersensitivity. That's what those letters stand for. So the top picture is environmental allergies. This lower picture is food-induced hypersensitivity dermatitis. And so, the striking things on these two pictures is very, very similar areas. So face and ventral abdomen, most commonly affected in both food and non-food allergies. There was a higher incidence of the face being affected in food allergic cats versus non-food allergic cats. So it seems like food allergic cats have more lesions associated with their face and may have concurrent gastrointestinal signs.